Hello, my name is Sharlene Dong. I am an internal medicine resident at UT Southwestern Medical Center in Dallas, Texas. I'm happy to share some results from my poster presentation at the European Hematology Association annual meeting. My poster is on the real-world carfilzomib prescribing patterns and outcomes in patients with relapsed refractory multiple myeloma. We felt that this project was especially important to investigate because since the initial approval in 2012 of carfilzomib or Kyprolis, there is not yet a consensus on the most effective dose. As a result, there are many different variations of doses and frequencies given to patients even today. We sought to investigate this by collaboration with the Flatiron team using a nationwide cohort of U.S. patients involving a total of 486 patients with relapsed refractory multiple myeloma. This spans both academic centers and community cancer centers. So we wanted to highlight a couple of different conclusions. First, we felt that based on our study, we found that once weekly dosing of carfilzomib or Kyprolis are becoming more and more frequent. Initially, Kyprolis dosed at 56 twice weekly was the most common. However, in recent years, carfilzomib or Kyprolis dosed at 70 milligram per meter squared once weekly and 56 milligram per meter squared once weekly was also becoming the most common regimen. Secondarily, there were many factors that influenced carfilzomib dosing, such as the location that the patient received treatment, such as academic or community center. Also social factors such as insurance status, medical factors such as performance status, and certain other medical conditions. And finally, the different partner drugs that were used with carfilzomib. Ultimately, whether or not carfilzomib was used as a doublet, triplet with immunomodulatory drugs or other monoclonal antibodies did impact the choice of the regimen. And finally, the third and perhaps most important conclusion was that in our study, we did not find any difference in overall survival or progression-free survival between the three regimens, 56 once weekly, 56 twice weekly, and 70 once weekly. Therefore, we feel that because there has not been any difference in outcomes, we feel that it is possible to suggest that carfilzomib 56 once weekly may be considered a new likely standard of care in relapsed refractory multiple myeloma. Thank you.